we have been getting emails, phone calls in our central office stating that dietitians really need to be licensed in California. All other healthcare practitioners are licensed. Physicians are licensed. Nurses are licensed. Pharmacists are licensed. Dietitians need a license, which they wanted to, one, to elevate the status of the registered dietitian in California. People ask, what's your license number? Well, you know, we don't have a license number, we have a registration number, and we go through this song and dance and him and hawing. And the Academy of Nutrition and Dietetics, I was going to say ADA, the Academy of Nutrition and Dietetics has put forth a plan to have each state get licensed. Licensure is a state agency, okay? Each state has its own licensing boards. California has its own licensing boards, as do all the other states. So 40-some-odd states have licensure for registered dietitians, and California is one of the few that does not. February 2011, we had a bill in the California State Legislature for licensure of dietitians. The licensure was to set and guarantee basic qualifications for dietitians, which basically says in order to be a registered dietitian, you have to have completed a bachelor's degree, you have to have completed an internship, you have to have passed a qualifying examination, and you have to maintain your units, which is exactly as it is now. There's nothing new that was going to be added. It creates a system of accountability. Right now, with the Commission on Dietetic Registration, you have to have 75 units every 5 years. You can go get all 75 in your 5th year. You can get all 75 in your 1st year. It doesn't matter, just in a 5-year period. When you get licensure, the state of California, in this state, would be the ones making sure that you had your units. And it would have to be, you have to report them every 2 years. They would still go to the Commission on Dietetic Registration and say, are these people still active? But here in California, we were going to have it so you have to report your units every 2 years. Now, one of the items that became a slippery slope, licensure in California would enable the public to receive nutrition care covered under the Affordable Care Act. What is the Affordable Care Act? Which is also known as healthcare reform. In the initial stages of the healthcare reform bill, it said that nutrition services, which everybody that's a registered dietitian was just elated that nutrition services were going to be covered. But at one point it said it had to be covered by licensed practitioners. Now in California, we're not licensed. So that meant no registered dietitian in California could get reimbursed under healthcare reform. We didn't know. So we said, well, that's one of the reasons we need to go for licensure. Got a bill before, actually it was a fascinating process. Public policy, writing an actual bill that would go before the state of California legislature. Fascinating. Fascinating. I had no interest in it prior to being involved in it. But it's just, if you like politics, you would have loved this. Even if you didn't like politics, you would have said, now that's kind of interesting, because it was a roller coaster ride. We wrote a bill, we got assigned a bill number, we got an author, one of the assembly people out of San Francisco was going to author our bill. And she did. And right before she was going to introduce our bill, all of a sudden people came out of the woodwork to oppose it. You don't need licensure. You're registered dietitians. You already have business profession codes in the state of California. You don't need licensure. It's a waste of money. Everything you could think of. We have naturopathic medicine people, various health food people nationwide converged on the California state legislature and said, well, if you introduce this bill and if you pass it, we're going to kick you out of office. And these are very large organizations. So the legislature said, well, why don't you and these organizations go work out your differences, then come back and let us know. So we took actually all of 2011 from February to October. We met with various groups, we met with lobbying groups, we met with people in their offices who sat there and said, no matter what you say, we're going to oppose your bill. That was minute 1 of a 60-minute meeting. So, we're like, wow, okay. So we had plans, we had everything laid out, we were explaining it to them. One person was listening, the other one sat there like this. It was first grade at its best. Yes.
Is that because we're going to be competing for the same?
No. No. There was no competition involved. It's just that once healthcare organizations get licensed, they don't want to give up. They feel that if anybody else gets licensed, that then will be infringing upon their scope of practice, which is what it says they can do, and infringing upon what they feel they can say to their members, we do this and no one else does.
Wasn't it?
Like nursing.
Yeah, wasn't it nursing?
Yes.
Or nursing the big?
Right.
Yeah.
The major opposition here was the California Nursing Association, which is not like the California Dietetic Association. The Nursing Association is a union. And I don't know what you know about unions. That's another whole big issue of things. I haven't known all about unions. There are how many dietitians? How many members of California Dietetic Association did I say in California?
6,900.
About 600. There are 80,000 California Nurses Association members. And since it is a union, their dues is taken out of their paychecks. They're automatically members. So they have no choice in the matter. So we had this, that was just one of the groups that were opposing us. And to make us feel better, on the day that our bill was to be introduced into the legislature, there were probably 4 or 5 other healthcare groups that had licensure bills that were to be introduced, and all of them got pulled. Same day, all of them. And they were calling us, we need to file a lawsuit. Yeah, you've got 2,000 members, we've got 6,000 to 7,000 members, and we're going to go against just one of these organizations? I don't think so. There was behavioralist, they were going to be licensed. There was some audiology group that was going to be licensed. There were many, many healthcare groups that needed licensure for healthcare reform, which was everybody's primary drive and focus, in addition to protecting the public. Primary goal for getting licensure is to protect the public from your bad actors, i.e. code of ethics. From your bad actors, you need to protect the public. Well, there aren't that many bad actor registered dietitians, but one of our goals was to make sure that we could take part in nutrition services as part of healthcare reform. So as of last September, when we went through the Healthcare Reform Act, we got the national organization involved. The national organization attorney came out and met with us in September. And in the whole healthcare reform bill, which is, you know, this big of a book, the part where it was talking about nutrition services and licensed healthcare, couldn't find that part anywhere. So over time, as the bill evolved, we hypothesized that that language was removed from the bill, from the Affordable Care Act, Healthcare Reform Bill. Anyway, the licensure bill that we had is now dead. Dead, done, gone. Now, Public Policy Education Day, which is where the dietitians in California, and a lot of students too, meet up in Sacramento. We're going to discuss what our next steps are. Currently, we have a letter going out to all California Dietetic Association members. So if you're a member, you will get a letter in the mail, or you'll get a letter in your email that tells you exactly what has transpired as far as licensure goes for dietitians and what we're doing. What we're doing is we're building relationships with legislators. We develop what we call Nutrition Nuggets. It's a monthly little, what fits on the smallest computer screen. That's all it is. It's just little tidbits about food, nutrition, what a dietitian does, etc. We send those to every legislator up in the state of California once a month. We also send it to their office staff, because their office staff are the people that actually do the work and do the emails. So what we're calling Nutrition Nuggets. We're building relationships. We are starting to visit legislators in their offices. They've never heard of a registered dietitian. They say, you're a nutritionist? Well, you know, some people call themselves nutritionists, and there's nothing wrong with that. But unless they have gone through the route that we have with the RD, it's not necessarily the same. Visit legislators in their home offices, and we participate in political events. And throughout the state, there are 10 districts in California. Each district has a legislation day where they invite their local legislators to come to a meeting and have a wine and chocolate, or there's always a little bit of alcohol to kind of loosen their tongues to see what it is we can do to get our licensure bill through. We have in California what's called Business and Professions Codes. If you go to the CDA website, dietitian.org, Business and Profession Codes, it lists what it is dietitians can do in the state of California. It lists exactly what jobs what you can do in your jobs. Primarily, it's medical nutrition therapy, and it's primarily related to clinical dietetics. You won't find anything in there about writing blogs. You won't find anything in there about being a consultant dietitian, because all of this stuff is kind of old, and all of this internet stuff is very new. Cyberspace is someplace where you won't find anything written in the legislation yet, because nobody knows how to handle it. Anyway, we're also going to start working with a PR firm. And what this PR firm is going to do for us is to tell us how best we can get our message out to the general public and to legislators that registered dietitians have value. Registered dietitians are not just someone that says stuff to patients in a hospital. That's what most people think. Registered dietitians have a lot more to offer. We have a very science-based background, and we use science-based evidence analysis in order to determine what it is we're going to say about various issues. So now at the Public Policy Education Day, which is March 5th up in Sacramento, we're going to actually introduce new legislation. We have found another legislator to introduce legislation that will clarify or clean up some of our business and profession codes. A business and profession code is something that tells what you can do, and they are approved over time. We've had business and profession codes since the 70s, 80s. They add this would be signed into law, that would be signed into law, that would be signed into law. Oh, wait a minute, the one that they signed in 2004 may contradict something that was signed in 1968. So, you know, there's a lot of mishmash, a lot of misunderstood, a lot of misinformation in some of them. So clarifying the business and profession codes will allow us to get one set standard for what it is dietitians can do. And we're going to go about that slowly. We're calling it our piecemeal approach to going back to licensure. So once we get the business and profession codes all cleaned up, then we will again try for licensure. So at Public Policy Education Day, March 5th, we will be introducing new legislation, new author, whereas our other one was called AB 575. That means it was introduced in the Assembly Bill, number 575. We'll have a different one. It'll be AB something else. So after Public Policy Education Day, if you don't go, look for your email newsletter or any other information. Go to the CDA website, and you'll find out what our new bill is and what is it going to be. We're quite excited about it. Now, CDA has an annual meeting. I mentioned that dietitians need to get continuing education units. The CDA annual meeting is where the educational process takes place. How many of you have been to an annual CDA annual meeting or an ADA annual meeting? If you've been to them, you know that there are a lot of sessions there, but there's also a lot of fun there. This year, the annual meeting is taking place at the Ontario Convention Center, August 26th through 28th in Ontario, California, which is 5 minutes from the Ontario airport, right down that freeway that I just yeah. So the annual meeting, there's continued education for the professionals. There's lots of hot topics. We're going to have discussions of people speaking on high fructose corn syrup versus sugar. Is one good, one bad? Does high fructose corn syrup actually cause you to get fatter when you have the same amount of calories as sugar? Actually, there was a report in the Annals of Medicine this week where they said if you just take same calories, high fructose corn syrup and sugar, there was no difference in weight. So a lot of researchers believe that high fructose corn syrup, which is supposedly the bad one, same calories as sugar, causes your body to make more fat. That's what some believe. Some scientific literature says yes it does, other scientific literature says no it doesn't. So that's one of those that's real slippery slope. Low-calorie sweeteners, we're going to have people talking about low-calorie sweeteners. So some of the hot topics, professional interest, nutrition informatics, have you guys heard of that before? Nutrition informatics, what do you think it has to do with? Nutrition information via computer, download mainframe systems, your personal medical history in various places, no matter where you go. It can be pulled up if you're in Alaska or if you're over in Louisiana. Your information can be obtained so that the physicians don't have to start over from scratch every time they see you. So nutrition informatics is one of the hot topics related to dietetics today. Unique topics. Unique topics are some of the things that dietitians are doing that most people don't know about. A lot of dietitians are running food banks. What does a food bank have to do with a registered dietitian?
We need better quality food.
Better quality food. What's the purpose of a food bank? Let's start there.
Provide food to people that need it.
Provide food to whom? Okay, the homeless, the needy.
Food insecure.
Food insecurity. If you've heard that term, food insecurity. There are a lot of food banks in the state, and a lot of dietitians run these food banks. Now, why would food banks why are they now becoming a location for community service? Some of these food banks Think about your economy. Think about
Yeah,
people
they're
losing their
serving
homes.
away.
Think about families that are being moved from a house to an apartment, to the car, to wherever, to nowhere. Food Bank in Santa Barbara, they actually have after-school programs for kids. It's the Food Bank in Santa Barbara. So the gal at the Food Bank in Santa Barbara, she's going to come talk. This is one of the unique topics. And in talking to her, we found out that the Food Bank of Santa Clara County, which is where CDA's annual meeting is next year, 2013, they have she runs one of the largest food banks in the state. And they are coming up with all kinds of meal plans for people with disease states, healthy states. No longer are food banks just places where they go and they take a pallet of food over to the church and the church serves the homeless. Food banks are becoming a community resource center for those in the community that don't have health care, don't have food, don't have food stamps, don't have what to make. So that's one of those unique topics that we're going to discuss at the meeting. New product exposure. The exhibit hall always has new products, things that dietitians need to try. I heard you mention the brownie made out of avocado and something or other else. There's all kinds of, what was it, avocado and what?
Black beans.
Avocado and black beans, all kind of that stuff at the,
And a lot of free stuff.
And a lot of what?
A lot of free
Of course,
swag.
there's a lot of free stuff. Yes, you always get your swag bag.
Yeah.
Too. Kind of like it. Now, what would be of most interest to you is our student new member reception. Every year at the CDA annual meeting, we have a student reception. And this year, we're going to have internship directors come, have a table set up, so that anybody that wants to discuss any internship stuffs, they'll have their table set up. We're going to have people just out of school who will be there to talk about what it is that you're going to encounter once you get out of school, do your internship, get out of school, get your RD, and you've been out for a year, and now what? So there's those kinds of talks. So the student new member reception is one that we recommend that students come to, and that is held, it's on Friday of the annual meeting. The annual meeting is Thursday, Friday, Saturday, and that's held Friday. If there's only one day you can come, I'd recommend that you come on Friday, because the student reception is Friday evening, and there'll be lots of talks related to students on that day.
Ontario.
Huh? Ontario? Ontario Convention Center, Ontario, California.
Last year was in Pasadena.
Last year was in Pasadena. Every year, since we're such a large state, we do 2 in Southern California to every 1 in Northern California. So next year, we'll be up in Santa Clara, which is basically San Jose. So Ontario 2012, Santa Clara 2013, and it'll be back down here in 2014-15. You'll get to network with other students, network with new members, meet internship directors, learn about internship programs, etc. And there's always food and beverage. Now, if you got that email that I was talking about that had listed all of these scholarships and other kinds of monies you could have received, this is the California Dietetic Association Foundation. The foundation is charged with providing scholarships. This year they have 9 $1,000 scholarships available. Deadline to apply is March 16th. If you did not get the email where it listed some of the others, there's a whole other slew of scholarships, I think by the Academy, that the deadline is March 1st, and that deadline hasn't passed yet either. If you're interested, you can email me. You guys have my card. Email me, and I'll get you that information. This is up on the website, www.dietetic.org. You can go up there and find out about all of these 9 scholarships that are available. And trust me, not a whole lot of people apply. Everybody goes, yeah, I'm gonna. And then sometimes the pickings are very slim, and so your chances are very easy. It's very good that you can get one of them. Any questions about CDA? Yes?
Well, you know, we're all students. Do you know if they're trying to expand internship opportunities for students, especially at,
I don't think so. They have a lot of online now, and you can actually, the Commission on, no, I don't know what it's called. I used to be called Katie. Commission on Accreditation of Dietetic.
Didn't it change the name?
It is.
Yes, okay.
It's Katie's.
A, C, and D,
Yeah.
right?
Yeah.
Okay. You can go up to the Academy website, click on their button, and then they'll tell you what there are. You can actually speak to, I'm sure, what's her name here, Dr. Hillstrom?
Yeah.
Yeah.
Okay. I know her as Mandy Graves, but that's not her first name. She was getting this big award. I'm like, who the heck is this Catherine Hillstrom? I'm like, oh, hi, Mandy, what are you doing here? She goes, I'm getting an award. I said, well, what award? I'm like, I've known that woman for years, never knew her name was Catherine Hillstrom. Anyway, professors know about other kinds of ways to become an RD. So I would speak with her. Dr. Jambazia, do you guys interact with her?
Yeah.
Speak with her. She and I used to teach together out of Ventura Community College. Lovely lady, lovely lady. Anyway, other professors, send me an email, ask me a question. Send me an email and just kind of put that you're a Cal State LA student, just put CSULA in there anywhere, and then I'll read it and not. Sometimes I get so many, it's unbelievable. Any other questions, comments? I thank you for waiting. I again, keep those, keep the tablets and the pencils. You guys go ahead and keep